or sitting on top of it. But that being said, just wanted to kind of communicate kind of the framework that a lot of the work that we're doing is. So the first piece is collaboration, and part of that effort some of you experienced during the regional TA, starting to recognize ourselves alongside of co-laborers who may not be getting RHY funding, but they're working with the same population and looking for opportunities to leverage efforts there. And some of that collaboration will also relate to some of the work in terms of transitioning youth out of TLP into some team mentoring models in the community. So collaboration is really about what can we do to support you in your collaboration efforts. And we actually have a guy, you'll hear tomorrow, and all he does is research collaborations. And he's going to soak in the RHY world, and he's going to speak to that during the plenary and then a little bit during the workshop. So some of the workshops relating to collaboration, the ones in red are the federal workshops, just so you can see how that is being represented in the national training. There's lots of collaboration. And so that's one leg of the stool. Another one is accountability. And accountability is not, as was mentioned earlier in the day, it's not about, my esteemed colleagues here and the FPOs saying, gotcha. It's about, helping us to be accountable as stewards of taxpayer dollars in terms of what we're accomplishing with the funding that we're providing, but also to help you develop internal accountability, ways that you can help the people in your organization all track to the same outcomes so we can maximize the impact on mission. Some of the workshops relating to accountability, the West Coast convening framework, building data capacity, a big part of it, calculating return on investment was one of those pieces, and I'm going to talk a little bit about CIPRA when we talk about the third leg, which is sustainability. That's the new add-on to my furniture for this year. And part of this is I'm not Congress. I don't appropriate funds. Just want to clarify that. I'm an administrator, but we value the work that you do. We want to see you continuing to be a part of this community and connected with this work. And some of you have been around for a while. You know that RHY grants come and they go. And those of you that have developed a strong sustainability plan can kind of withstand those deserts and stay with us and continue to serve youth. And some of the items relating to sustainability are shown here. But the one I want to talk about, how many people know what CIPRA stands for? Anybody? Anybody that I haven't told already? Anybody? Am I missing somebody? Okay, good. She's close. CIPRA. What is CIPRA? Social Impact Partnership to Pay for Results Act. This is something I think you need to pay close attention to. I know people have different reactions when they hear about pay for results. It's something new, but according to Dr. Banks, that means it'll generate more dopamine in your brain. But more importantly, this is another potential source of funds. As Dr. Evil would say in Austin Powers, Department of Treasury in the Bipartisan Budget Act was funded $100 million. And that money is going to go out through states and localities to support pay for results programming. And in case you're wondering whether the initiative relates to your work, what you see here, these are excerpts of the types of outcomes that they're looking for in the CIPRA programming. And you can see this is this is the programming and the outcomes that a lot of you are dealing with. So I just want to put in a quick plug for the CIPRA workshop. If anyone was involved in the ROI, the same thinking that goes into ROI is going to help you in terms of Pay for Results Act. So that's all I wanted to say, and I will hand the podium back over to the people that were running this afternoon session.
All right, thanks, William, and welcome to our FISB General Federal Session. And I think that as the program managers and myself thought about how to frame this session this year, we did rely on the evaluation results from last year to definitely feed the way we structured it this year. And so with that, I'm gonna, once they bring the slides up, I'm gonna share the structure of it with you. So we have our, what we call our national, our network of providers, and so they will each come up and share a little bit about the work that they do. I think Debbie mentioned earlier this morning that we have a new executive director for the National Runaway Safe Line, but we also have our Runaway and Homeless Youth Training and Technical Assistance Center, who's going to share some of the new and innovative things that they're working on. And then we also have our National Clearinghouse on Homeless Youth and Families, whereas before it used to be the National Clearinghouse on Families and Youth, it's now specifically targeted to homeless youth and families. And so, just to give you an overview of what we're going to present, we are also going to have some information on our RHY HMIS data upload and dashboard updates, and it's just a teaser in terms of what we're offering. And then we're going to provide some of the FISB updates related to some of the work that we're conducting. So without further ado, I'm going to ask the National Clearinghouse on Homeless Youth and Families, Susan Long, to come up and join us.
Thanks very much. So I'm Susan Long. I'm one of the team members for the National Clearinghouse on Homeless Youth and Families. We officially launched last November. We were here at the conference last year. You may have seen us. And we're a true clearinghouse. We invite people to come into our website or call our toll-free line, find some information, and we also push information out through blast emails, and we invite you to come and subscribe to those at our table, which is out and to the left. We do not inundate your mailbox. We send stuff out maybe 2 or 3 times a month. So this is a picture of our homepage. We redesigned the old NCFI site. We have information about funding opportunities, and we've already talked to a couple of people about sustainability of programs, so we know that's a very important topic in the room. And we also have research summaries, which are summaries of, well, research, and also programmatic information. So, and a lot of it is freely available. We give you the information about where to find it. And recently we have started sending out every couple of weeks and last email around a theme. The last one was trauma-informed care, with some links to resources and from our research summaries database and from some organizations about webinars and training opportunities. One of the big reasons why we're here is that we want to know what kind of information you're looking for, what you need, how you would like to see that information and get that information, and how we can help. So I hope you will come and see us, as I said, out the door and to the left. And Tell us what kind of information you're looking for and in need of. This is everybody on our team. We left John Lingen at home. I think some of you probably know John. He worked for the NICFI clearinghouse for several years, and we're lucky enough to have him on NICHF. We left him at home minding the store, but the rest of us are here, so please come find us. I know Jerry, I'm sure everybody knows Jerry Tracy, and Jeff are roaming around, and I'm sure many of you will get to meet him. Thanks very much. Thanks for your time.
And I'll call Lori Jackson up from RHYTAC.
Good afternoon. You all know me. So I'm with the National Safe Place Network. We are happy and privileged to operate the Runaway and Homeless Youth Training and Technical Assistance Center, RHYTAC for short. We are headquartered in Louisville, and we have satellite offices in Florida and in Tennessee. In this current 3-year project period, we have a couple larger partners that work with us: the American Institute for Research, Youth Catalytics, the University of Tennessee, and several state partnerships that also work together to provide training and technical assistance and information for all of you grantees. Many of you may know, and some of the newbies may not know, that we also have a 25-seat RHYTAC advisory board. We really work with grantees to gather information to be able to provide the best training and technical assistance resources for you, and one of the ways that we do that is by utilizing an advisory board. So as we rotate through our different project periods, the folks on that advisory board turn over. So we are at a place where we will be opening up nominations for the RHYTAC advisory board. So look for that on the website, and that's at RHYTAC.net. And I forget that I'm in charge of this. Maybe. No. No, wrong way. There we go. There are 5 program requirements for the Runaway and Homeless Youth Training and Technical Assistance Center. As you can see, they're listed here. I'm not going to read them to you, but we do go through each of these as we look at the information that we share as part of RHYTAC and working with both our federal project officer and the leadership at FISB. One of the things that is new this year is the Runaway and Homeless Youth Program Network, and Debbie talked about that a little bit this morning as well. So RIPEN for short, and that is including RHYTAC, the Clearinghouse, and the Safe Line and additional partners. The technical assistance framework is one of the things that has been put together over the last few years, and this, as you can see on the screen, there's 3 different tiers. One is the universal technical assistance, really general information provided around runaway and homeless youth, emerging issues, and how FISB-funded programs meet the needs of RHY in different communities. Tier 2, which is really targeted technical assistance, and Tier 3, which is more intensive, and that's one-on-one, and that's really done at the partnership and guidance of federal project officers and the central leadership at FISB. As you know, we do lots of training activities, so this is the list that you see in front of you. We do both facilitated and recorded webinars. Those are always available once they're completed on our e-learning site, and if you would like access to that, again, just feel free to let us know, and you can let us know that via email or through our website. We do interactive learning modules. We do pickup trainings, which again get approved by leadership, but those are really when grantees get together and we come on site and there is a location picked and a topic picked, and we work to share that information with grantees. And it's for all grantees, so we put that out as we schedule those. We do have trainer of TOTs that we do in trauma-informed care, demonstrating effectiveness, some sustainability ones, and then there's also one that really works with individuals to improve your effectiveness as a trainer, if that's something that you do at your location or in your agency. We do youth care certification that really aligns up with those core competencies of youth workers that we see in funding announcements and the final rule in those things. So let us know if you have any questions about that. One of the new things that happened that RHYTAC and FISBE put together last year were the regional meetings. We had great input and great feedback from those sessions. So those are again in process. We're finalizing the dates for those, and you'll hear more about that coming soon. So look for that in your region. And finally, we do this event. So the national training happens every year. We're excited to put that together for you. I think as you heard this morning, this is the largest RHYTAC training that has occurred, and we look forward to continuing to build on that and have it be bigger and better as we move forward. One of the things that we do every year as part of RHYTAC is we work to get information from you, the grantees, so that we can work with FISBE and leadership to provide the best information back to you and the best training. And so the grantee assessment happens, and as you can see here, in the 2018 grantee assessment, we had more than 900 responses. That is just phenomenal. We were so excited. It provided fabulous information for us, and it was, everybody responded from CEOs to frontline workers, those folks who are brand new in their first year to those who have over 40 years of experience. So this data is used, as I said, to develop the information that is shared by RHYTAC. This is just a list of additional resources. We do have a community of practice, has over 800 grantee participants. Our website, rhytac.net, has information about everything that we do, ways to access us. It has training resources, technical assistance resources, connections, all of that information. So please, go to the website, take a look at it, let us know how we can, again, share additional information with you. And then we have our e-learning site, which also has over 200 additional resources on it. So, thank you.
Thank you, Lori. And now I'll call up Susan Frankel from the National Runaway Safe Line to share some information and updates about the Safe Line as well.
Hello, everybody, and good afternoon. I'm a little short, so I think it's still in my face. Okay. I am the new executive director of the National Runaway Safe Line, which I know has been mentioned quite a few times this morning and this afternoon, so I am just absolutely thrilled to be here with all of you this afternoon and throughout the next couple of days to meet with and talk with so many of you. It is an absolute pleasure and honor to be able to get to know you and to learn more about how we can all work together going forward. But just for a few minutes, I want to tell you a little bit more about the National Runaway Safe Line and who we are. We are a national organization based in Chicago, and we hold near and dear our mission, which at its heart is about ensuring that runaway, homeless, and at-risk youth across the country are safe and off the streets. But we also have the privilege, and there we go, to also be the federally designated national communication system for runaway, homeless, and at-risk youth across the country. And essentially, what we do in this capacity is we offer 24-hour services, 7 days a week, 365 days a year. These services are confidential, solution-focused, crisis intervention services and support for runaway, homeless, and at-risk youth and their families, again, from across the country, as well as offering ways to work with all of you to access our resources as well. And how we do this in this capacity is that we operate a 24-hour hotline, as well as an extensive menu of digital online services ranging from tech services, which help really provide youth with knowledge and information about which 24-hour services they can access through us, as well as email, an online forum, and a 24-hour chat system. So we are trying as much as possible to offer an array of ways that youth and their families can reach out to us at any point in time when they are in crisis or when they are in need of resources and the kinds of services that we can link them to. And that is a key component of what we do and who we are. is we are managing and operating a very extensive national database with over 8,000 organizations, entities, and services that are out there. So as youth are reaching out to us, we can help to link them back to local resources, local support, local services in their own communities, or whichever community they have found themselves in at the moment. I do also just want to emphasize, I don't think it's here on the slide, but we operate the Home Free program in partnership with Greyhound Bus Services. If you're not aware of this service, we really want to make sure that you learn more about it. It's a way that we are able to provide free transportation through bus tickets for youth who would like to return home to a parent or guardian, of course, as long as it's a safe and good option for them to return home to. And we are able, because I've had a lot of questions about this already today, to serve youth 12 through 21 years old through that program. In addition to the crisis intervention services that we offer, I just want to emphasize we also have an entire education and prevention component where we really work to distribute and provide resources, material, and information about issues impacting runaway and homeless youth, as well as prevention materials, including our runaway prevention curriculum, which there are available CDs at our booth in the exhibit space, as well as all of the modules are downloadable off of our website. So please take a look at that and see how you can access that and put it to use in your own communities as well. So just to tell you a little bit, super excited about fiscal year 2019 as we get going. A little bit about what you might see from us in the coming year. And hopefully within the next few weeks, we will be releasing a 10-year data trend report that's really taking a hard look at what the homeless, runaway, and at-risk youth look like who have been utilizing National Runaway Safe Line services over the course of the last 10 years to help really influence us as we begin to look forward and continue to build out and build with you what our services look like, but also to help really provide very critical and important information that really teaches all of us about why youth are leaving home, why they're calling, and what their needs are. In addition to that, I'm very excited to really focus on and increase our outreach and our efforts in working with families, territories, and underserved populations, including Alaska Natives and Native American communities. We've already begun some of that work, and we continue to look forward to working to expand our efforts in those areas. You will see enhanced national visibility from us and very concerted efforts to build our national partnerships and our partnerships. We know that serving and meeting all of the needs of runaway and homeless youth is a big job, and we need to do it collaboratively and in partnership with all of you. And then the final point on this that I just want to touch on before we get to the very exciting thing about tomorrow is that you will see us really taking a hard look and evaluating how we are delivering our services. We need to make sure that we're providing the right services at the right time and the right communication via the right communication tools to the youth who need us. So, if you do not know, the real reason that Halloween exists is so we remember that the next day after October 31st is always November 1st, which is the start of, come on, Gordon, help me out here, National Runaway Prevention Month. And so I need all of you to be as excited about National Runaway Prevention Month as I am. If you do not have one of these, which is your green flashlight, please stop by to pick one up, because you need to help us and we need to work together to shine a light on youth homelessness and ending youth homelessness in this country. And so that is really what National Runaway Prevention Month is all about. So we have a fun video that I have no idea how to play. There we go. awesome music choice. So as you can see, we are very excited about National Runaway Prevention Month and thrilled to be partnering, of course, with FISB and many, many national partners to make this happen. There's lots of information about it online as well as at our exhibit space. And I do want to just emphasize tomorrow morning at the poster session, I know you are all planning to join us and ready to take selfies because not only is it the launch of National Runaway Prevention Month, but it is National Selfie Day. And that is the way that we are going to build awareness and make sure that everybody across the country knows how important these issues are. So last but not least, just really quickly, I guess it's up to me to make that, I went the wrong way, or there's not a slide. Ah, it is, okay. Just, you can find us throughout the next couple of days at our exhibit space. We are happy and love to talk to as many of you as possible. And then obviously I mentioned the poster session, and we do have Rachel Reynolds from our awesome NRS team will be presenting tomorrow morning as well. But you can reach us 24 hours a day at 1-800-RUNAWAY or online at 1-800-runaway.org. And then of course, please follow us on social media. That's how you will be kept up to speed on all the fun things underway for this month. Thank you so much.
So I just want to say again a huge thank you to Susan Long, Lori, and Susan Frankel for sharing all of the wonderful work you're doing as part of our networks of providers. And so moving on, and so this is a part that's near and dear to me, and I get very excited when we start talking about data. But I'm going to make it short and just provide you with some updates related to the RHYHMIS, or our Runaway and Homeless Youth Homeless Management Information System. And I think that many of you already know that it's a legislative requirement in the Runaway and Homeless Youth Act for us to collect statistical data. And so we do that through our RHYHMIS system. And so just wanted to have you mark your calendars that we are having our fall upload. Typically, it coincides with our national training event, but this year, since it was a little bit earlier, I just wanted to make sure that you guys are aware that it's coming up on November 12th, and it will end on November 30th, and we're requiring that all active RHY grantees must participate since this is a legislative requirement. I know some of you may have just gotten funding, and so we know you still haven't collected data as of yet, but we know that next year when we have our spring upload, you will be required to submit your data. And so, excuse me, for this particular reporting period, we're asking you to submit your data. That's from October 1st of 2017 to September 30th of 2018. So 12 months for all of your runaway and homeless youth that you've collected data for. And also, every year we have this for the last 3 or 4 years. We also provide individualized technical assistance through our contractor, which is American Institute for Research, or AIR. And I'm hoping John McGaugh is in the room. John, if you're here, can you stand up and wave? Up, there he is. So John McGaugh and Candace Hacker over there. So those are the two individuals that will be providing the individualized technical assistance for those of you who need some additional help in terms of extracting your data through the CSV file and uploading your data. And so with that, I also wanted to share a little bit of information for those of you who are grantees that are new to RHYHMIS. So I think in terms of data collection, we've heard some questions about who can collect data and how you can share data. So we do know that for youth under the age of 18, you don't have to get consent to collect the data, but you do need parental consent to share their data. And then for youth over the age of 18, you do need their consent to also share the data, but again, similarly, you don't need their consent to collect the data. And so just wanted to make that distinction in terms of data collection and data sharing. And so just wanted to quickly share with you some of the responsibilities that you have as grantees in terms of preparing yourself for the upload and then conducting the RHYHMIS data upload. So we want to also make sure that you have all of your data in for October 1st through September 2018. We also want to make sure that you've been working with your HMIS lead to have your RHY projects properly set up through HMIS, and making sure that once you work with your HMIS lead, that you're only collecting the universal data standards plus the RHY data standards. I think some of you have shared that you're collecting additional information, so it's really critical to work with your HMIS lead to make sure that you're only collecting the universal data standards, which are mainly demographics, as well as RHY HMIS data standards. And then I think many of you may know, but I just wanted to reiterate that for BCP, you should have two systems set up, one for prevention and then one for emergency shelter services, and you should be entering information in both. And to make the distinction between prevention and emergency shelter, so if a youth spends at least one night in your shelter program, then they should be entered into the BCP emergency shelter component of your project. The other piece that I wanted to share is that we have some new data standards that we implemented in 2017, where we're looking at several of the 4 core domains, where before we only collected that information at program entry, we're now collecting it at program entry and exits to do a comparison. So one of them is education, the other one is employment, and with education, we're not just collecting the grade that they're at when they enter the program and then when they exit the program, we're also collecting information related to how are they attending school, whether it's regularly, irregularly, and we want to be able to track that as well. And then just wanted to share with you that you should have gotten an email notification, but we will be continuing to provide you with more information and reminders of the upcoming training on how to upload your webinar, as well as other guidance and information and some frequently asked questions that we've been working on and updating to share with you. So I think that many of you heard about this thing called the RHY HMIS dashboard. And so with that, I think it's a long time in coming. We're excited that we got a provisional authorization to operate and to be able to share the dashboard. And so I'm going to put in a plug for our session tomorrow morning from 10:45 to 12:15 in Salon G, where we'll have more about the dashboard, and John will be doing a live demonstration of the dashboard. But I just wanted to offer some information in terms of a teaser, so to encourage you all to come and view the dashboard live. But I think that we're going to share what are all of the filters available through the dashboard, where you can look at by year, you can look at your data by quarter, by month. You can look at it by program type, whether it's BCP, prevention and emergency shelter, by transitional living program, by street outreach. And then we can also slice the data by looking at it at the national level, at the regional level, the state level. And then we can also look at it in terms of demographics, by the state level, again by the regional level, and the national level. And we also are looking at some of the 4 core domains as we talk about outcomes, and so you can look at it by education and where are you in terms of meeting that particular standard. So this is just a sample of the dashboard, looking at it from a national level in terms of aggregate information. And so with that, you can see that we have the opportunity, and the filters are at the top, to filter down through, and you can do it, and each of the grantees will have access to their own data, but also sharing that the federal project officers will have access to their regional data and each of their respective grantees' data as well. And so I think this will be a really good tool to as we work to monitor grantees in partnership, to have a discussion and to identify what are your successes, where are you experiencing challenges, and how can we better support you when you're experiencing challenges through training and technical assistance. And this is just a sample of what the a safe and appropriate exit looks like in terms of the 90%, and this is at the state level. And then this is a sample of the grantee level data where you can look and compare it, where you see the green bar is the grantee data, and then you can compare your data to the region and state level. And so it's looking at, again, this is the safe and appropriate exit, which is one of our core outcomes. And so we can see that this particular grantee had met the 90% set standards. And so with that, I'm actually going to turn it over to Jeff Daniels, who is a program manager for regions 8, 9, and 10.
Thank you, Risa. Well, good afternoon, everyone. This is the best time slot of the day, right? Right after lunch? I see the enthusiasm in the room. I am Jeff Daniels, the Regional Program Manager for Regions 8, 9, and 10. Not to be confused with the movie star who played in Dumb and Dumber with Jim Carrey in 1994. I get that quite often, quite frankly. Anyway, now that I've got your attention, just want to touch base on a few FISBE updates. This is really the broad spectrum of where we stand. We want to show you sort of our organizational chart, where we stand within the Health and Human Services Department, and then also introduce to you your federal project officers. If you don't know them, you should, and hopefully you will get to know them during this week, and introduce the fact that we'll be doing the breakout federal project officer workshops where you'll get to go with your regions right after this. So I think I have the clicker here. Okay, so taking a look at the Family Youth Services Bureau, that's what FISBE stands for. I've actually had people ask me what that stands for. If you take a look at it, we are within the Department of Health and Human Services. The Honorable Alex Azar II was sworn in as the Secretary of Health and Human Services on January 29th of this year. Following the chart here, you can see that we're a part of the Administration for Children and Families. You may hear often we refer to that as ACF. And then the Administration on Children, Youth and Families, ACYF. And then we have the Family and Youth Services Bureau. Within the Family and Youth Services Bureau, we have the Division of Adolescent Development and Support. We refer to that as DADS. The Honorable Dr. Matthew oversees that here to my left. And underneath that, we have the Runaway and Homeless Youth Program, along with the Adolescent Pregnancy Prevention Program, often referred to as APP. And then a part of the Family Youth Service Bureau, we have the Family Violence Prevention and Service Division. So that's our overall organizational makeup. I'll introduce the team here. I know many of you may know these folks, but as part of the Runaway and Homeless Youth Central Office team in DC, the program manager for that specific team is Chris Holloway, here to my left. Yay. He loves it, so the more, he does one of these things, you know. We have Toyin, who is the Street Outreach Program Coordinator and Logistics Contract Contact. Carol Bush, who is our Clearinghouse Contract Contact. Anna Cody, who is our Human Trafficking Specialist and National Runaway Safeline Contact. Gloria Watkins, who is the Basic Center Program Coordinator, also the Grant Review Contract and RHYHMIS Lead. And then Angie Webley, who I believe is here. Angie, would you mind standing up? Angie, stand up. She is our TLP Coordinator and RHYTAC Contact. So thank you, Angie, for being here. So we break down the national spectrum in essentially 3 teams. We have Team East, Team Midwest, and the best team, Team West. No, I'm just kidding. That's my team. We have the Regional Team East, which is the Regional Program Manager here is Keith Wallace, who is actually in Dallas. Keith. So Team East is comprised of Regions 1, 2, 3, and 6. And just for your informational purposes, right after this, we're breaking out. So if you're a part of Region 1, which you can see on the slide, Maine, Massachusetts, New Hampshire, Vermont, Rhode Island, and Connecticut, Keith is going to be leading that particular session. Region 2, made up of New York, New Jersey, and Puerto Rico. Myrna. I knew that. Myrna is here. Where is Myrna? Were you, Myrna? Oh, there she is in the back. See her back over there? Hey, Myrna. All the way from Puerto Rico. She'll be your Region 2 project officer. And then we have Region 3, which is DC, Delaware, Pennsylvania, Maryland, Virginia, and West Virginia. That'll be led by Habiba. Habiba is in the very back. See her back there? All right. And of course, Region 6, Arkansas, Louisiana, New Mexico, Oklahoma, and the great state of Texas. Your federal project officer is Rebecca Eichelberger. And she is, Rebecca, where is Rebecca? You standing up, Rebecca? Okay, yeah, there she is. Hey. All right. I didn't see you back there, Rebecca. Thank you. Okay, so we have the regional team Midwest, and that the regional program manager for the Midwest is Aaron Kelvington here. He's out of Region 7 in Kansas City, and the breakout room will be for Region 7, or actually it's Region 4 will be, and that's Alabama, Florida. That's our southeastern region: Alabama, Florida, Georgia, Kentucky, Mississippi, North and South Carolina, and Tennessee. That'll be led by Alicia Parks. Alicia? There's Alicia. All right. Region 5, Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. That's Jessica. Where is Jessica at? Is Jessica in the room? Okay. It's really, oh, there you are. Hey, Jessica. All right. And then Region 7, Iowa, Kansas, Missouri, and Nebraska. That'll be led by yours truly, Aaron Kelvington here. All right. Team West. All right. Where are our West Coast folks at? Yay. All right. So I've introduced myself. The Region 8 group is Colorado, Montana, North Dakota, South Dakota, Utah, and Wyoming. That'll be led by Deb Yatsko. Deb, I saw her over here. Deb, you got to stand up. All right. There's Deb. Okay. Region 9, American Samoa, Arizona, California, Guam, and Hawaii. That'll be led by Deb Oppenheim. Where's Deb? Okay. Hey, Deb. I did want to introduce, we will be getting a new federal project, or a couple of new federal project officers, one in Region 8. She'll be joining us later next month in November. Her name is Maya Herring. She's not here with us, but she's joining on November the 13th. And then in Region 9, of course, we have Patrina Winston, and then Angelica Gutierrez will be joining us later in November as well. So she'll be a new federal project officer also. And then that says Region 7, but it should be Region 10, which is Alaska, Idaho, Oregon, and Washington. Tom Bonington will be leading that session. Tom, where are you at? All right, there's Tom over there to the right. Hey, Tom. All right. And the other federal project officers in that region are Janice Holt and Steve Ice. So a few of the announcements we want to talk to you about forthcoming actually, and I know this gets your attention, is the funding opportunity announcements. So the street outreach program, we're anticipating the publication in spring of 2019, approximately $7.7 million with 52 awards. Also the Basic Center program, again, anticipated in the spring of 2019 with approximately $16.2 million worth of awards and 89 in total. And then, of course, the Transitional Living Program, Maternity Group Homes, which is, we're anticipating that information to come out at the end of November. So just kind of want to give you an update what to look for forthcoming. And then we, again, as you said, as William mentioned earlier, the regional trainings, we wanted to give you the schedule and the dates. So we want you to have this for planning purposes. And you can see there the locations and the dates that we're expecting to host those regional trainings. And again, information about these trainings will be forthcoming as well, such as the logistics, location, and that type of information. And just want to show you the rest of them here. Again, we will be having all 10 regions with a regional training. And that's it for my portion. The next person. Okay, I'm sorry. Yeah, I'll go back to the beginning. So take a look at your region there if you want to write it down. We'll go to the next. Okay, and we'll have it on the website also. And without further ado, I'll turn it over to my esteemed colleague, Mr. Keith Wallace.
Well, we're coming up on the end of our year where we get our evaluations, and I just would like to take this opportunity to say I have the best boss in the world sitting right here. Hopefully that'll reflect in my evaluation. So, now I know we have new grantees and seasoned grantees with seasoned staff and even new staff here. We have new grantees. So I want to welcome you all. This is a great opportunity not to just hear from us or your federal project officer, but to network with one another. In previous years as a former grantee, I probably learned more vital information at the bar in the evening from other directors and staff. Not that the workshops aren't great, but you can really get into the weeds in the evening and afternoon hanging out with some other folks. So I encourage everyone to network, trade cards, so you have contact information and you can continue sharing information, best practices, asking questions throughout the year. So we want to go through the RHY programs. You guys know, and I hope I hit this the right way. Yeah, we already did that. So we have Basic Center program, which is the shelter, and we have Street Outreach program, and then we have the Transitional Living program. And within Transitional Living, we have Maternity Group Home, which is specifically, as those of you that have that program know, is for pregnant parenting youth. So we're going to talk about definitions, but before I do, I want a show of hands. How many of you are fairly familiar with the Runaway Homeless Youth Act and Rule? Okay, got a few. That's good. That's very encouraging. Now, how many of you are familiar with your funded application that you have right now for your programs? That's encouraging. All right, as a former grantee, I'm going to share with you a secret for success. Directors, program managers, make sure your direct line staff, your street outreach workers, your shelter care workers, your case managers, everyone that's working with runaway homeless youth in your program have had an opportunity to review your funded application and your logic model so that they have a full understanding or opportunity to ask questions and clarify what it is they're supposed to be doing, what the expectations are, so later when you have a site visit, they're not caught unawares. That does happen on occasion, and it's just because we forget to share that information. And also make sure that they've had an opportunity to review the act and the rule so that they have a full understanding of not only these definitions we're going to go through, but also why the program exists, how it is structured, what the expectations and requirements are. That saves a lot of time. So runaway youth, this simply means an individual under the age of 18 years who absence themselves from home or their legal residence without the permission of their legal guardian or parent. A street youth is an individual who is a runaway youth or indefinitely or intermittently homeless youth spends a significant amount of time on the street or in areas that increase the risk to such youth for sexual abuse, sexual exploitation, prostitution, drug and alcohol abuse. And for this purpose of this definition, we're speaking of youth as an individual who is less than 21 years of age. Now, homeless youth means an individual who cannot live safely at home with a parent or legal guardian or relative and has no other safe alternative living arrangement. For eligibility in the Basic Center program, they must be less than 18 years of age. And for eligibility in a transitional living program, that is 16 years to less than 22 years of age at the time of program entry. Now, youth at risk of separation from the family is a youth who is less than 18 years of age, has a history of running away, and parent, guardian, or custodian is not willing to provide for the basic needs of this youth, or who is at risk of entering the child welfare system or juvenile justice system as a result of a lack of services available to the family to meet those needs. Contact. Now, this is kind of important. In contact with street outreach programs, what we're speaking of is actual one-to-one interaction. Not necessarily, well, not at all, going into a school and speaking to 200 youth. That's not contact, that's great outreach. It's a great opportunity to talk about your program and services available to youth. But a contact is really one-on-one. That could occur on the street, or that could occur in the drop-in center, or at another facility operated by that program. Outreach means finding those runaway homeless and street youth, or youth that are at risk of becoming homeless and runaway, who might not know of your services or be aware of how to take advantage of your services. So we want to provide that information to them about the services and benefits and encourage them to use your services. A drop-in center is optional. It's a great opportunity to reach street youth that you may not otherwise reach. And this is staffed by your program if you're running one of these operations. And clients can come in without an appointment. They can get advice or information. They can receive services. They can get referrals. It's an opportunity to hang out with other street youth, opportunity to engage with your staff, and to access services that they otherwise would not have available to them. A temporary shelter is all basic center program shelter settings in which runaway and homeless youth under 18 are provided room and board, crisis intervention, and other services on a 24-hour basis. That means they need to have access to your shelter 24 hours a day, 7 days a week. This is for up to 21 days as a maximum residential capacity, or minimum rather, residential capacity of 4 and a maximum of 20 youth in a single structure or building. Now the 21-day restriction is only for the use of RHY funds for your basic center program. It's not a restriction on how long that youth can stay in your shelter under other funding sources. And with that, I'm going to turn it over to Chris Holloway.
Thanks, Keith. Are the handhelds active? There we go. All right. So you may be wondering, why did Keith just read definitions that you could have read yourself? And I'm sorry, I don't want to stand behind the podium and get a little antsy back there. We did some acknowledgments earlier this morning, and before I get back to answering the question about Keith reading the definitions, I would like any RHY staff person, whether you're direct line, middle management, even an executive director, if you have been involved in RHY less than 5 years, please stand up. Don't be shy. Awesome. Stay standing. Don't sit down. Don't sit down yet. All right. If you've been involved with RHY less than 4 years, remain standing. So 5 years you can sit, less than 4 years, remain standing. Less than 3 years. Less than 2 years. Look at the bright, shiny new faces. Let's give them a round of applause. Please go ahead and have a seat. You're the future, guys. You're the ones who are going to carry this mantle forward in the years to come. And I hope that you're enjoying your jobs. I hope you're taking advantage of the opportunities for training, getting to network, that you're appreciating that we really want to invest in you the necessary resources and information so that you can be successful at your jobs, and that you can in turn help those young people that you provide services to be successful as well. So back to my question, why did Keith read those definitions? And the reason is that I can guarantee anyone in this room that when we go into our general breakouts later, we're going to have at least one person come up and say that they didn't realize that that was the definition of one of those terms. That they didn't know that basic center could only go up to 18. It had to be under the age of 18. Or that 21 days was the maximum stay. I can guarantee it. I'll put money on the table that that will happen. Does that mean it's bad? No, but it emphasized why it's so important for us to convey this information to you in as many ways possible, in as many opportunities that we have, so that you understand in the context of our federal funding that we have certain restrictions that we have to focus on in order to stay consistent with the law and the regulation. So my section here is very brief, but it's going to be a little interactive. So I need you all to get ready with your hands. We're going to go through a series of questions, and I want folks to raise their hand at each question, I'm going to ask for those who agree or disagree, and then I might pick on one of you to give me a justification as to why you picked one decision or the other. All right. So, question 1. Is a drop-in center an acceptable alternative to street-based outreach? How many people say yes? Raise your hand if you think drop-in centers are an acceptable alternative to street outreach. Oh, you guys are good. I thought I was going to trick you on this one. All right. And then how many people say no? I hope everybody raises their hand. All right, I'm going to keep them up, keep them up. I'm going to pick on somebody. I'm going to pick on you. That's what happens when you dye your hair blue.
You want my reasoning? Well, as a street outreach worker, I like what I do, so I would like to think that I'm having an impact outside of the drop-in center, especially because a lot of youth don't know that drop-in centers exist. It's my job to direct them in that way, if that's what makes sense for them, but sometimes a drop-in center isn't the best fit for a youth for whatever reason. Maybe they've aged out, but they're still a youth. Maybe they have children and the drop-in center isn't very young, itty-bitty friendly. There could be a variety of reasons that a drop-in center isn't a catch-all. So the street outreach workers are kind of the fan beyond that has a broader reach.
Sam, right? Where are you from, Sam?
Minnesota.
Sam from Minnesota. All right. All excellent responses and all absolutely true. For the context of why I asked the question, the answer is no, not because of all those great things that you said, those though they are completely applicable. It's because the law says that you have to do outreach. Plain and simple. That means you have to meet the young people where they're at, not just necessarily have them show up to you. So in many ways, your response captured that essence. But if you're running an SOP program, the point obviously is that you can't just do a drop-in center. You have to have an outreach element. You have to go to where those young people are congregating. You have to find them. You have to give them the necessary opportunities to make those informed decisions about leaving those environments that they're living in. All right, next question. How does FISBE define prevention? Now, you can't raise your hands on this one, so I'm going to ask just a volunteer, throw your hand up if you're willing to try to give this one a try. This might be a little tricky. No brave soul. Oh, I got a hand going up. Please say your name and where you're from.
Judith Clark from Hawaii. Prevention services are designed to strengthen families and resolve the issues that could potentially lead to a youth leaving home either voluntarily or being thrown out by their family.
Awesome. Thank you, Judith. Let's give Judith a round of applause, please. She's the only brave soul that raised her hand, so you all are in her debt right now. All right. So this is more of a complicated response. We do not define prevention anywhere in the RHY program. You will not find that word anywhere in the law, the term prevention. Bet you didn't know that. So, for the purposes of your programs, prevention is anything that happens prior to entry into a shelter, particularly for the purposes of the Basic Center program. So the minute that you do an intake on a young person and you assign them a bed, they're no longer in a prevention status. They're now being sheltered, right? If they stay with you for one night and you release them back to their family or they move on to some other placement, that's considered aftercare. So 90 days after they have left your shelter, that time frame is called aftercare. So anything that happens before intake, before they're sheltered, is considered prevention. Now, what you do during that time frame, during that prevention services time frame, is really wide open. And I know that it's it's a concern that many of you have expressed to us. And so what we'll be working on in the coming months is to try to build some parameters around what we view as appropriate use of RHY funds and resources directed towards prevention. Okay? Next. Can legal guardians utilize BCP residential services to provide respite care? Ooh, I think this one's going to generate some interesting responses. If you think a BCP can be used for respite care, raise your hand. I see one tentative, like I think maybe. Anybody else? All right, so other than that one person, everybody else should raise their hand and say, what? No. Who would like to give me a reason why no is an acceptable response? I'm going to come to this side of the room and pick on somebody over here. I got a couple of hands. Yours was high and mighty, so I'm going to give you the microphone. What's your name and where are you from?
Monica Lill with Friends in North Carolina. Respite care generally falls underneath of mental health behaviors, foster care systems and things along those lines, needing temporary placement in their in-between periods.
Okay, good answer. Anyone else have anything to add?
The BCP should be accessed on a voluntary basis, so the youth would need to want to access.
Also a good addition to the response. All right, so what do we say here? A legal guardian cannot abdicate their responsibility to provide youth shelter by intentionally bringing a youth to a BCP. There's some gray areas in here, and we have to acknowledge those gray areas. If it's Friday night and mom, dad, and the young person are in conflict, and mom and dad say, get out of my house, you're not welcome here anymore, what is that person now defined as? Just yell it out. Let's go back to Keith's definitions. You don't have a safe, stable place to live or an alternative place to go. What are you considered? Homeless. So, if you're homeless, you're eligible for BCP. If mom, dad, family member, guardian kick you out, you're no longer welcome in their home, you are now classified as homeless. The important piece to this is that you all have the responsibility to document this adequately, to make sure that we all understand why it is that you're intaking that young person into your shelter. Are they a runaway? Are they homeless? And do they meet all of those conditions that Keith read off in a moment ago? Okay. TLP programs. This one's for you. Can maternity group home programs serve young couples? If you say yes, raise your hand. A couple more hands. Interesting. If you say no, raise your hand. If you think that an MGH can't serve couples, raise your hand. You got to have a vote one way or another. Can't sit on the fence here. Yes or no? All right, give you one more chance. Yes, they can serve couples. Raise your hand. Raise them high. Come on, come on, come on. All right, no. Raise your hands. I'm going to pick on somebody that said no. You're standing out right there. You said no. Why did you say no?
Well, I sat in your class earlier, and I think I remember that it was for the youth and a mother that is with a child or having a child, and it wasn't geared for families.
It's good justification. I can see the rationale. Who says yes, that you can serve a couple? I got a couple of hands over here. I'm going to swing back to this side. Keep your hand up. I'm eyeball right there. Yes, you right there.
It is my understanding that as long as the youth parents qualify for BCP supports are homeless within the appropriate age range that we can accommodate couples, parenting, or pregnant.
All right. So we are talking about transitional living program. That's okay. So I would say that the essence of your response is pretty well on target. Anybody else want to tack on to that, add any additional thoughts? All the way over here. Now I'm just getting my steps in for the day. Whew. It's a good thing I wore my walking shoes. Almost done. Just a couple more questions.
My name is Heather. I'm a program manager for MGH program. So we can't house couples in our program, especially if they're opposite sex couples, because we house young mothers. However, we do serve the co-parent as well. We provide case management services if we can. We engage them in workshops and family building activities if it's healthy relationships. So they may not necessarily live in our program, but they are receiving services from our program.
Great, thank you. Let's give Heather an applause. Oh. So, the gist here is there's no specific prohibition to doing this. If you have program limitations about cohabitation of male and female clients, that's a rule that you've put in for the purposes of your program. You could have a scattered site apartment, and maybe your scattered site apartment program allows for mix of genders in a particular facility. We're not talking about legally married individuals. These are people who identify as a couple, and it doesn't have to be a father, mother necessarily. There's no gender identification here in the just notion of couple. The point being is that this is about your program implementation and how it is that you choose to provide services to pregnant and or parenting youth. So thank you for all those responses. A couple more. This one should be easy, I hope. Can youth with a probation officer be served in a basic center program utilizing FSBE funds? I think there's a little trick here. So, how many people think that if I'm the young person coming into your RHY Basic Center program, if I have a probation officer, you can serve me? Yes? All right. How many people think, no, you cannot provide me services? All right, I'm picking on you because you're close by. Why can you not provide services?
I should mention that I don't work in a basic center program. I've done maternity group home and street outreach, but my understanding is that the entity that funds the probation officer is responsible for ensuring the safety of that youth, and they need to be ensuring the safe housing. So they shouldn't be using homelessness response funds.
That sounds like a legitimate answer, right? What about those of you who said yes? Somebody who said yes, you can serve a youth with a probation officer in a runaway and homeless youth basic center program. I'm coming back over here. You people who sat in the back of the room are lucky. I can't walk that fast.
When it came to parole, no, from 18 to 24. When it came to young people that were on unsupervised probation, that means they had a probation officer to make sure they met the fines or whatever the needs of the court. It's a once-a-month deal. They weren't incarcerated and they weren't put in detention. They were left out on their own. They were expected to find a job and expected to find housing in order to stay unincarcerated.
That's an interesting twist to the response that I didn't necessarily think of. Absolutely correct. I mean, if they're on probation and living at home and they get kicked out, they're now considered homeless, right? And the response here is yes. If they've run away from an ordered placement, whether that's a juvenile correctional facility, a residential treatment center, group home, whatever the court has decided in terms of a condition of their probation, or if they've left home, they cut off their electronic monitoring, and they took off and they ran away and they found themselves in a situation where they didn't have any place safe to sleep, then yes, they are eligible to be in an RHY program. However, once the Basic Center program recognizes that this is a systems youth who has now absconded from their legal placement, whether that's their home or whatever facility that they're supposed to be housed in, that system has an obligation to take custody back, or at a minimum, the shelter should have some type of financial reciprocity with that system, so that the RHY program's not paying for the bed, that system is paying for the bed. And as we've said before, many times, I as a probation officer, Jeff as a judge, Keith as a police officer, Aaron as a child social worker in child welfare system, we cannot place a youth in one of your RHY programs. It's a voluntary program. If the youth says no, there's no court order that should allow you to house that youth under our RHY dollars, and that's the distinction here. You may have other funding sources that pay for other beds, but they're not RHY beds. All right, that's it. Fun little quiz for the afternoon. I'm going to pass this off to Aaron. By the way, I just want to point out one thing. So this is the progression of a goatee in 4 days. No, day 1, day 2, day 4.
Thank you for the compliment. I'm very proud of my beard. I'm going to stand back here because it becomes distracting when I walk around. Just kidding. I'm the last one to speak, and then I will set you free and we will go meet up in our regional teams. I want to echo the great, having those folks stand up that are new, right, in this field, that was great to see the number here. You guys are, and gals are the future. You know, many of us on the stage, probably just about, say everybody here, you know, started out as a youth care worker, or you know, maybe a group home manager, or, you know, something to that effect, and have made their progression in this process. And so you really are the future for our programs, especially because if you don't know already, right, the work that we're doing, that we're serving, the youth that we're serving, it's so transient. I mean, when I was a grantee, you know, just 15 years ago, so much has changed in what's going on with youth. You know, we've got RHYMIS now. Back in the day, we used abacuses to tabulate, you know, thing. I still have blisters. So there is a need for this, and I've been excited in what I've heard so far from the folks that have been here on the stage or even in the room. You know, the knowledge that you have next to you is critical to share. So if you've been doing this for a long time, you know, I encourage you, I know you are, I encourage you to talk and share how it's going and how it went, how it is, all those types of things. One of the things I wanted to highlight too from Dr. Baker, was that her? Banks, sorry. I love the neuroscience thing, and one of the things that struck me that she talked about, and I've framed it into how it came across to me, was you have access to an entire system or network, and I'm going to say of positive resources. And you've seen that today with, you know, RHYTech, with the National Center